Our mission is to end inequality in genomics and improve precision medicine for all people. So what is genomics? Put simply, genomics is the study of an organism's genome. The genome is the entire set of DNA instructions found in an organism, and it contains all the information needed for an individual to develop and function. Decoding this can lead to many benefits, such as a better understanding of disease risks, personalized medicine, and even ancestry information. So how do we access our genome? And how do we benefit from it? Whole genome sequencing is one method to access our genome. This method has been around for some time, and more recently you may have come across it in the news for the monitoring of COVID outbreaks across the globe. This technique has many benefits in terms of clinical and research applications. In fact, in terms of cancer, we find whole genome sequencing plays a crucial role in diagnosis and treatment. This is due to its ability to provide comprehensive information about the entire genetic makeup of an individual's DNA. Of course, cancer is a genetic disease and is now the leading cause of death worldwide. It arises from the transformation of normal cells into tumor cells. However, many cancers have a high chance of cure if diagnosed early and treated appropriately. So there are several key reasons why whole genome sequencing is valuable in the context of cancer. Firstly, it has enabled us to take greater strides when it comes to the concept of personalized medicine. Secondly, it is the gold standard for detecting a wide range of genetic alterations. In addition, it can help in the early detection of cancer risk in people. Whole genome sequencing also has a role in the monitoring of genetic changes over time. Another feature would be its important role in research and drug development. In fact, drug development based on genetic reasoning can offer much greater success. Finally, whole genome sequencing plays a pivotal role in the era of precision medicine, where treatments are increasingly tailored to the individual characteristics of each patient's cancer. In summary, our genomes contain our unique genetic fingerprint, and one method for analyzing the genome is whole genome sequencing. This technique brings many benefits in terms of clinical and research applications. For example, it has the power to improve early detection and treatment for those who develop cancer. Unfortunately, there are problems, and I will mention the key issues here. Firstly, there is insufficient genomic representation from certain communities. In fact, even up to 2021, when looking at genomic studies, 86% of them have been conducted in individuals of European descent, while African, Asian, and Latino account for less than 8%. This underrepresentation is also in the human reference genome. This is a significant issue when you consider that most alignments or comparisons from any sequencing project are made against this unrepresentative reference. It means possibly new discoveries or actionable alterations may be missed, ultimately meaning only certain people from a limited background can benefit rather than all of us. To be representative, a reference genome needs to encompass many more sequences from people all over the world. This way, genomic findings can help all populations. So what has contributed to inequalities in genomics? There are several reasons for these inequalities, and I will mention some here. Firstly, there is a clear lack of diversity in researchers. There is also a lack of expertise with handling multi-ancestry cohorts. This is mainly due to concerns around population stratification. Thirdly, large-scale studies are expensive and time-intensive. Finally, there has been a history of research abuse and exploitation. These are just some factors that have played a part in generating this inequality. Another problem is that the commercial landscape is also lacking complete, comprehensive genomic testing. Most are still using non-whole genome sequencing-based methods. In fact, most of the leading companies are using older technology called SNP genotype testing. This means they only assess a snapshot of the genome, and in fact only examine around 0.01% of the genome. It's the genetic equivalent of spot checking a few letters in each chapter of War and Peace and trying to decipher the plot. In fact, if we look a bit closer at the genetic testing market, we find more problems. Firstly, the false positive rate may be as high as 40%. Also, 94% of these false positives have been found in cancer-related genes. Thirdly, most of these companies are not even allowed to sell tests as diagnostics. In addition, 67% of companies didn't provide sufficient information on how the consumer data would be utilized. The third problem is the need for commercial diagnostic testing that can be trusted and even seen as an effective partner by healthcare practitioners. Currently, there is a lot of negativity associated with commercial genetic testing. They often have been gaining a reputation for panicking people and wasting time due to often compromising on technology and standards. However, there is also clear space for companies offering quality genetic testing, as a study at the ICR found that applying the NHS guidelines for gene testing might be excluding up to half of all people at cancer risk, and so excluding many who might have actionable alterations. In summary, there is a significant lack of representation from certain communities in genomics. This means that certain people or populations are invisible when it comes to diagnostics and targeted treatments. Also, in the commercial space, there is a lack of high quality and affordable comprehensive genomic testing. So what is the solution? Well, we at HumanSeq believe that the solution is to focus on four main areas: technology, time, trust, and togetherness. We aim to focus on these areas to deliver on providing a genetic testing company that can disrupt the existing status quo. HumanSeq has the right experience combined with a desire to not compromise on technology or reporting. Furthermore, we believe that genomics should be for all of us. In terms of our competition, there are two main groups when looking at cost and quality. The first group mainly use SNP-based array technology, and this would represent the lower end of the market. These such companies tend to offer very limited and non-comprehensive testing. The second group is mainly companies that are offering sequencing options. However, this said are more expensive. HumanSeq aims to achieve much greater affordability and higher quality service, and believe we can disrupt the current market, allowing greater accessibility by consumers. So there are efforts underway to help tackle the issue of genomic inequalities. The problem is that people will likely not be getting their data back from most of these studies. Also, some of these studies have decided not to use the best strategy to deliver on their aims. All this means that it will be unlikely that many of the people tested will even be able to benefit. However, HumanSeq aims to do things differently, as we aim to use our expertise in this field to lead research in the right direction from the start. By doing this, we want all people to benefit from any genomic findings. HumanSeq aims to focus on four key areas to provide an affordable, high-quality service that can change the status quo and end inequality in genomics. HumanSeq has a clear strategy for achieving this, and phase 1 will be to sign up our initial cohort of 100 people. So thanks for listening, and I hope you will consider signing up to learn more on how to enroll and be part of our pioneering pilot cohort. Also, any feedback would be greatly appreciated.